Yes, we can start now.
Okay.
Yes, I'd like to welcome everybody to the March 15th, the Ides of March Health and Human Services Committee meeting, brought to order at exactly 1:01 p.m. Shauna is not going to be attending today, so I am taking over the hosting duties. And any changes to the agenda?
Yes, Henry. We have a budget adjustment, ID number 9991, that was sent out on Friday to committee members. And we also have an addition of an advisory board appointment to the Human Resources Commission.
Advisory appointment to
Human
who?
Resources Commission?
No,
Is
it's the
it-
human right. Human
Right,
rights.
human
Oh, I'm
rights
sorry,
commission.
human rights, sorry.
Okay. Is there any public comment, Kathy?
No, Henry, there's not.
Okay. Chair support, there is none because I haven't had time to prepare one. So let's go to the COVID-19 vaccine update. Frank or Amy?
I'm talking away and you can't hear anything I'm saying. Good
Frank.
afternoon, everyone. By way of COVID update, we'll start on the disease front. We've seen double-digit numbers the last few days. I guess almost a week now. We're up over 100. I think we're about 120 current cases. Sunday was a slower day. I imagine today will be a slower day because there's less testing on Sunday. But we'll have to keep an eye on it over the next few days to see what our trend looks like. A lot of students in these cases, so we've definitely still got work to do with our partners in higher ed to continue to get the message out about the necessity for continuing to follow the public health guidance, that there is still risk. I think the good news is that all of our higher ed institutions have really good practices in place for when a case is identified to be able to isolate and quarantine quickly. So it generally limits the extent of the exposures that we see. So generally things are still good, right? Obviously we'd like to see our numbers a bit lower. Our hospitalizations are very low as well. So we're still, in a spot that's probably better than we might have thought at this point, but not quite as good as we could hope for. On the vaccine front, a lot of news since the last time this committee met. A lot of changes to eligibility. It's widened pretty significantly. Most recently added public-facing public employees, public-facing nonprofit employees, public-facing building services workers. So quite a few more people added, and the age was lowered from 65 to 60. So probably I think that's the most recent changes we've seen. The most impactful change that's occurred is counties are no longer restricted within those priority groups. So as you may recall, previously our allocations, we'd get a certain amount for comorbidities, a certain amount for 1B workers, and we were not able to do 65 plus. So all of that has gone away. We are now able to vaccinate anyone that is currently eligible. So we continue to use the registry to help us work through populations. We are starting to work our way through the folks that get added to the 1B as it expands. We are still trying to do saturation in the previously eligible populations before we move on. So we're efforting right now with our current allocation, which groups will be sending the link out to, but that will be happening shortly for this week's allocation. Another bit of good news, because we have demonstrated our ability to get large amounts of vaccine administered quickly. The state the last couple of weeks has called and asked if we wanted to accept additional allocations. And we of course said yes. And so that has really, it's actually almost doubled our allocation each week. The cat's out of the bag too, that we're able to manage Pfizer, which as you all know is a little bit harder with the deep freeze capacity, and thanks to the partnership with Kaga Health Systems, we're able to do that. And so now we're getting Pfizer as part of our base allocation, which before we were only getting Moderna. So it's good and bad news. The bad news is a little bit harder to handle and manage, and the pharmacy staff at the hospital are working overtime to manage the handling component. The good news is it comes in minimum of 1170 doses. And that's the minimum shipping capacity. So we know we're getting at least that much. And if they've got another tray for us, that means another 1170. So that adds up quickly. So we're thankful to be able to get those extra allocations to continue to vaccinate here in the county. We'll be doing 3 clinics this week. We'll be announcing shortly, likely tomorrow on our normal Tuesday press release about our allocation. Breaking news, we got 1,770 doses this week, and we'll be working through what populations we're going to prioritize those through in the next day, and be announcing that tomorrow. So generally good news around the vaccine front. I do know that Syracuse has moved to 24 hours, so there's more availability there. And the county, I think everyone knows, has launched in partnership with Our Bus, transportation to those state sites for folks that can't get it here locally. So all good news on those fronts. We did Saturday, the second dose clinic for the pop-up at Beverly J. Martin, and that went extremely smoothly. No waits. We had 97% of the folks returned, and we were able to use the other doses on people waiting for second doses that may have missed an appointment somewhere else. So we were able to use all 216 doses. There was no wait. At some point during the day, I think we were all looking around saying, what are we doing wrong? This is going so smoothly. I think folks had a really good experience that came through. Probably weren't there more than a half an hour to get their second dose on Saturday. So that was a success as well. This week, we are going to be going out to Groton with our mobile vaccination units to do 2 senior housing facilities out there to continue moving through the income-based senior housing. And REACH will also be doing some more of the homeless population this week as well. We've allocated a few doses to our local Office of Mental Health and Substance Use Services folks to make some calls and to try to register some of those individuals that are currently eligible to make sure that we're reaching those hard to reach populations as well. And also we're going to be using 211 again this week to make some calls for folks that are prioritized from the registry that don't have access to the internet. So we continue to try to reach as many people as we can. I think that's all that I have, Henry. I'm happy to answer any questions.
Okay. The first question is from Amanda.
Thanks, Frank, for the update. I have 2 questions and a comment. Can you tell us, do you know how many people are on the registry list at this point?
Like 16. No, it's about 17,000, I think.
We've had 19,000 and it's down to 17 at this point.
Yes, we've had about 20,000 people total register, and there's currently between 16 and 17,000 on there. After the clinic runs at the mall, we take all the people that got vaccinated and remove them from the registry.
Okay, great. And second question is, as government employees, do we elected officials now count to get vaccinated?
Yes, elected officials are eligible.
All right. I thought I was going to be like the last person. This is great. Okay, and then my comment is that my mom, who lives in Newfield, came out of nursing retirement she's been volunteering up at the site to give shots and help the folks in the waiting area. And she's had a really great experience. You know, I'm very proud of her for coming out of retirement to do this. And so thank you for running a great operation. And she's, you know, been really impressed, although she has said it's a really long day for an old lady to be there all day. But other than that, you guys are doing great stuff. So thank you very much.
Okay, next person is Martha Robinson.
Thank you, Henry. Frank, thanks for this so much good news. Can I ask, what do you see for a quick question, transportation, I thought that was just going to Binghamton. That'll take people to Syracuse too?
Oh, it's just Binghamton?
It's Binghamton. I can answer it. For now, it's just Binghamton. There is discussions about the potential of going to Syracuse and other sites, but we are just trying it right now to the Binghamton site.
Okay, great. Thank you very much. So looking ahead, so Frank or Amy, what do you think might be, dare I say, the next roadblock? You're managing a lot of different things. And as Amanda said, the nurses or the people giving shots are working very long days. What else might be, you know, in the pipeline that you would looking for as far as more support?
Yeah, it's a little tricky right now because where the supply is still the limiting factor, and it's unpredictable. Let's say it's 75% predictable, but that last 25% makes it a bit more challenging for scheduling something as complex as what's happening at the mall. Once we settle into a system where vaccine is readily available and the mall is just running regular clinic hours, kind of like the testing site, right? It just kind of operates each day. They have a standard schedule. People know when they're going to be working. It's a little less taxing on the staff. Right now, because we don't know what day the vaccines are coming and how much we're getting, it's hard to schedule too much in advance. And then when something doesn't show up, you're canceling schedules and moving people's lives around. So that's not helping to the stress of the folks working up there. I'm hoping that we're getting closer to a point where the supply will be more predictable. We're actually moving into a model now where we're going to be doing first doses kind of Wednesday, Thursday, Friday, and second doses Monday, Tuesday, right? Because what we had been doing was trying to do it exactly on the 21 or 28 days. And that meant every 3 or 4 weeks, flip-flopping which days were first doses and second doses. And you don't want to do a first dose on a Monday because Tuesday's the deadline. And if something goes wrong, you don't have any window. And you can't do it on a Tuesday, a first dose, because that's when the vaccine arrives. So there's just a lot of logistical things that we're going to settle into a more regular schedule that I think will hopefully help with the staffing and some of the stress associated with that. I do know the hospital has begun their volunteer credentialing process. So they do have, I think on their website, a link for folks to click on to volunteer if they want to be a vaccinator or non-clinical folks up at the site. So they're working through that process. I know I've seen a few familiar faces popping up there doing vaccinations that I know are volunteers. So I think we're starting to build the more sustainable model, but really the vaccine supply is what creates the uncertainty right now.
Okay, that's, boy, so much to think about. One other question. So I was lucky enough to qualify and get an appointment at the mall a week and a half ago. I noticed that the parking lot where the testing had been going on was full of people parked for vaccines. And I thought, well, where's the testing? I mean, is the mall still a testing site? And I understand you still have thousands of tests a day. I'm trying to picture where that's happening.
Yeah, the testing is actually in the back of the mall now. And it has been. Is that where you saw cars parked, or were you thinking it was
Yeah.
still out front?
Yeah, I mean, when I got tested some months ago, like the line of cars wrapped all around the parking lot where
Yeah, yep. It's a different model now, Martha. They're doing primarily saliva collection there. So the way that the testing site works, it's still there. It's in the back of Sears there, or next to Sears, where the old tire shop used to be for Sears. They actually converted those bays into the testing windows. You collect your tube when you first pull up, and then you park to collect your saliva. So those folks that are parked there are actually spitting into a tube to collect the saliva sample. And then once they're done, they put their hazard lights on, and the people monitoring the parking lot go up and direct them up to drop off the tubes of saliva.
Ah, okay. All right. Got it. Thank you very, very much.
Any other questions? Okay, I have some. Frank, I know that that there's a concern about that the variants may in fact plant the viruses and they may be served. Do you know whether there's much testing done?
I can't hear you, Henry.
Okay, can you hear me now?
Yes. Yep.
Okay, there's a concern about a surge with the variants to the COVID-19. Is there any sense that that's taking over Tompkins County, that the variants have been more plentiful?
Well, we've certainly identified variants here. And I think, over time, just as we're seeing in other parts of the country, some of those variants will become the predominant strain that we have. I don't think that that's unexpected. I think it's part of the natural evolution of the virus. I think the important thing is that it really doesn't change what we need people to do, right? We're still asking folks to follow the same public health guidance. We're fairly confident that the vaccine will protect against those other variants as well. Only time will really tell as the science evolves on that. But even with new variants in our community and others, what we're asking folks to do doesn't really change. Obviously, if we see the disease moving differently through our community because of the variants, we would definitely be alerting folks and asking for whatever appropriate additional action steps might be necessary.
Also, you said Syracuse moved to a 24-hour operation. Has any other state site moved to 24 hours?
I don't know particularly. I know in the city there's a couple of 24-hour ones. Really the only ones I really pay attention to are Syracuse and Binghamton, because that's the one we get the most questions about. But I do know that they are also looking to open 10 additional state sites. One in Corning and one in Oneonta would be the closest to us. So the state is looking to open up more state vaccination locations.
And last question, do you know whether you'll get the Johnson vaccine?
We did not get it allocated to us this week. I kind of thought we might, but we didn't. We were told that March was going to be a little touch and go with the Johnson & Johnson because there was not a lot to go around. They do expect that by the beginning of April, it should start to become a bit more consistent. But we continue to ask for the Johnson & Johnson each week because we want to use that to target our homebound populations.
Oh, okay. Any other questions? Okay, well, thank you for your presentation, Frank.
Great, thanks everyone.
And now I guess the county administrator's report. Amy?
And I'm back.
As you guys switch chairs?
Well, we're back and I don't really have much of a report to provide to you today. We are not in this committee, but we are finalizing kind of the search for the Department of Emergency Response, and that's where the county administrator is today. So hopefully they'll be coming out of that soon. As far as everything else, very focused on the reimagining public safety report and the subsequent meetings with that, and then all of the COVID response. So no real updates for today.
Okay, any questions? Well, you do have a resolution.
Oh.
The renewal of the lease of Alcohol and Drug Council. Can I have someone move that? Amanda? Anyone wants a second? Dan Klein seconds. Okay, why don't you tell us a little bit about it, Amy?
So this is just an ongoing lease renewal. The Alcohol and Drug Council have been in our mental health building for quite some time. They've found some advantages to being so close to our mental health services, and so this would go ahead and extend that lease.
Okay, any more discussion? Okay, why don't we bring it to a vote? Dan Klein,
Yes.
Amanda Champion,
Yes.
Mike Sigler.
Yes.
Okay, and the chair also votes yes. So it's unanimous 4-0. Okay, well, if there's nothing, I'm also supposed to be in the Department of Emergency Response interview process now, but I'm here. So hopefully they're having a fun time. Okay, well, I guess there's nothing else to talk to the county administrator about. We can move on. Thank you.
Thank you, everyone.
And now is the health department. Answer question, and Liz, can see Liz Cameron is here from the health department. So why don't we go to Liz?
Thanks, Henry. So the resolution you have before you is a result of, I guess it was last month, it's been a bit of a whirlwind. Planning approached us because they were not going to be applying for the 2020 Community Development Block Grant this year, and wanted to see if we had potential ideas for it. And we were quite excited about this and are hoping to hope this all works out, and so that we would be able to target income eligible people who have an on-site wastewater treatment system, a septic system, a sewage system, all kind of the same thing. And this grant would pay for repairs or replacements to their systems that are, of a certain age or threatening to fail or, inadequate, essentially. So that's what we are hoping to submit an application for. One of the aspects of it is you have to have a waiting list that is 2.5 times what you're submitting the grant for. And we have been thrilled. We got a Survey Monkey out there to see who might be interested and eligible. And that's been circulating. You guys probably saw that survey. I think we sent it out to the legislature, and we've had, for us, a really good response. Like we've had 142 people already respond to this. So that puts us in the, based on the waiting list, we now have, what we can submit a very respectable sized grant application. The maximum is 1 million, and we're starting to get in close to that. So I'll take any questions, or you guys have the resolution in front of you. It goes before Health and Human Services, and then before HED, and then to the legislature. I think it's going to the legislature like a day before the actual grant application deadline of April 9th. So it's a pretty tight time frame for us and for you guys.
Okay, let me read. It's authorizing submittal of 2020 New York State Homes and Community Renewal Development Block Grant Program application ID 9989. Can I have a mover on that? Amanda Champion moves it. Can I have a second? Mike Sigler seconds it. And so is there any questions for Ms. Cameron? Dan Klein.
Well, I'm not sure who the question is. Probably for Jonathan, who's not on this call. I'm one of the people on the list. I have responded to the survey. I just thought about this now. Does anyone think that that's a conflict of interest for me to vote on this? I should have asked about this ahead of time. I'm sorry.
Because you might be a beneficiary of it.
Yeah.
I think I would recommend that you abstain at this meeting and then look into it further. That would be my opinion.
That's a good opinion.
What are the odds of an individual getting a grant, Liz?
You mean if we're the county would have to be awarded it? Well, you know, it all depends on how many people we end up with on our waiting list, because
Right.
then we will develop some type of priority criteria, right, for who we would target first. So you have to have a waiting list that's 2.5 times larger than what you're applying for. So that sets the minimum odds of getting a replacement, of receiving grant funds.
Okay, so by definition, since it's 2.5 times the number you're applying for, the number you're applying for is the limit that you'll be receiving? Or in theory, receiving?
Yes, yeah, we would, yes, essentially a third, right?
Right.
The people that apply might be able to get funding.
Okay. Any other discussion? Okay, let's vote on it. Amanda Champion,
Yes.
Mike Sigler,
Yes.
Dan Klein,
I think for the first time ever, I abstain.
and the chair votes yes. So it's approved by a bare margin of 3-0.
Thank you.
Thank you. Okay, now we're going to go to department updates. Why don't we go with Kate Cheng's booth from the youth department.
Good afternoon, everyone. How are you? So a couple things. I wanted to introduce Megan Lyon. She's our new coordinator for community youth services. She started with us a couple of weeks ago. She's doing really great. She's going to be working mainly with our community councils or the youth commissions in the different municipalities for our rural youth service system. And so we've been traveling around the county, virtually at this point, going to virtual meetings, introducing her. We're working on orientation packets, setting goals for 2021, and just helping them streamline their process a little bit. The other thing is summer camp is a really big question right now and is on everybody's radar. So our summer, the Tompkins County Youth Planning Task Force is meeting regularly the second Wednesday of every month at 2:00 to bring people who are doing summer camp recreation. Renee Borgella from the health department and then some people from the daycare council are also coming to answer some questions and to sort of break down and demystify some of the regulations as they come down, or to provide, questions to the best of their ability to things we don't quite know yet. But we're really trying to make sure that that is simplified, and working with DSS to have for the subsidies that come down to help low income folks pay for summer camp. That's something we're going to be doing here by the end of the month. So we're busy in that, and just really happy to be here today with you. I hope you all are staying warm.
Any questions for Kate? I do have a question. I know that in prior years, the summer camps have hired people starting in February or March to work the camp. So you find that be a problem or troublesome?
Well, we know this year that there's going to be a lot more camps operating if they can make it happen, right? And I think that the COVID vaccinations are kind of an issue, and then also making sure that you have more than one person in key positions, right? So to make sure you have two people that are qualified as directors, because if one goes down and has quarantine, that can actually shut it down. And so there's some added complications to that, but it's I think that they're reaching out and finding that staff will come back. It's just figuring out how to work through the regulations, knowing staffing. How many staff do you need, I think, is an issue, right? Because you have to keep right now the pods, I think, have to stay together, right? So how do you do that? A lot of them did before and after care. They're now no longer doing that, and they're extending days. We had some camps that were dependent on youth employment services for kids to have for youth to have summer jobs, but they can only work so many hours. So how do you keep the pods together, keep them with the counselors? So there's a lot of things that are issues with staffing, but I think people are ready to get back, and the kids are excited to get out. So.
And have you done the announcement about when the camps will take place yet, or are you still waiting for that?
So we are right now, I think, there are several camps that have decided that they're looking into it more deeply. They're deciding whether or not they're going to have indoor space. A lot of them are waiting on schools to see if they'll be able to access the buildings. A lot of them are thinking about doing pop-ups outside. Some of them have camp pavilions. But during inclement weather, that can provide a little bit of an issue if you can't bring them inside, right? So I know for sure that we've got 2 camps that have said they're going to operate. The rest of them are really close and intend to do it. But we're still waiting to hear back from that. And then the other thing too, what camps will offer, as soon as we get into summer, as the health regulations change, they may be able to offer different programming toward the end of the summer or in the middle of the summer than they did at the beginning. So we probably are going to be using our online registration this year is the one place we would direct families to keep updated on that information.
Okay, last question. I know that in the past there's been a concern about DSS and how people be guided through it. Since you're doing all online, what are you going to do to take that into account?
Henry, I can't hear you. I'm sorry.
Okay, that there were concerns in the prior years of the DSS scholarships or whatever, and people applying for the camps. And I know that they did it mostly. They had some tender loving care to help them process those applications. Since you're moving it online, what are you going to do to account for that?
That's a really good question. I can say one of the local municipalities was having this conversation last year. They did at the end of April, they do sort of invite all the camps into the school district and people can apply if they need to. And then DSS was invited to be there, and then they met with the families in a separate space. And so they are kicking around the idea of they've got a local, they do a chicken barbecue every year. So maybe having a pop-up tent that would be available outside to bring people in. They may set up it really would be dependent on what Kit would be willing to do, but I think bring some of those staff in and make sure that we've got those safety protocols set up, because we know that not everyone has access to the internet, right? I just think it's kind of figuring out how to do that safely for everyone involved, but it is on the radar for sure.
And the other thing I'll jump in with, Henry, is that I think, so I think we can definitely talk about, how we can access. The other thing is that we at DSS are doing and are approved by the state currently to do a lot more applications over the phone. So as in the past, it might have been more complicated because we really had to be able to kind of all get in the same room or have people come to DSS. That's a lot more fluid right now. So I think I think we'll be able to do a lot more by phone. And I know, I also know that places like the child care development, why can't I say their name correct? Thank you, Council, that they will also be able to kind of assist us in referring and making sure that people know that they can pick up the phone and call us. So I think we can make it accessible to people. We'll just have to get creative, like you were saying, Kate.
Yeah. Thanks, Kit.
Okay. Well, why don't we move next to Kip Kephart, the director of DSS. And here you guys got some funding from the American Rescue Plan.
Yes, so so our next, we've been informed at this point that we are going to get another allocation of ESG money. So that's the money through the CARES Act. And we're excited about that. I think with the inevitable lifting of the moratorium, which we don't know exactly when that's going to come through, but we know it's going to probably be soon. We're excited to look at how we can best utilize that money to really support people, primarily with housing costs or back housing costs. So currently, I will probably be officially bringing that information for approval to this committee next month. The reason I didn't bring it this month is because in order for us to actually get the allocation, we have to complete an application. It's kind of a strange process because, most of the time you complete an application and then eventually you're awarded the money. This is a little bit backwards. They actually tell you you're going to get the money, but then they send the application to you. You're required to meet all the requirements around coordination of how that is going to be utilized in your community. That involves pulling together a proscripted group of people to kind of discuss and make plans around that. And then once we submit that, they'll say, yep, you're all good to go. So that's what we're waiting for right now, is to finish that process. We really are just beginning that process this week. And then I'm hoping, like I said, next month that I'll be bringing that forward to this group. So that's exciting. I think that we, that first round of money, it kind of got a slow start because I think what we've seen is with the moratorium still in effect, there were certainly people that were utilizing it, but probably not at the rate that we might have expected if that moratorium had gotten. Oh, sorry, Martha's asking, what does ESG stand for? So ESG is the Emergency Solutions Grant. So it is. I should always clarify acronyms because we live in the ABC soup over here. It's the Emergency Solutions Grant, which is I think the full name is something like Emergency Solutions to Prevent Homelessness, and it's part of the CARES Act. So it's if you look it up online, it's ESG-CV, which just means that it's money for in the COVID time. So we're in the process of engaging with those folks that we're required to work with, and then we'll be putting together a plan and bringing it next month. And then hopefully OTDA will kind of, give us the sealed approval, and we'll get that next round of funding to really help as we have the eviction moratorium go away. So that's an exciting piece of news. The other thing that I want to just tell people briefly about that we're pretty excited about at DSS is, so we were required by OCFS Martha wants to ask a question. I won't move on to the next thing if you want to ask that question, Martha. Sorry, Henry, I'm not trying to.
Go ahead.
Yeah, thanks very much, Kit. So you and I corresponded about the rental assistance, the emergency rental assistance that was passed in December, $25 billion nationally. And then I passed that information on to the state lawmakers we met last week. Is that different from this ESG?
It is. So the ESG money, is specific to families that have been disadvantaged as a result of the COVID pandemic. And then the portal that they are developing for the ERAP, which is the Emergency Rental Assistance Program, that is also going to be related to COVID, but there's very little information out about that right now. My understanding is that will be broader, that is going to cover people who have experienced some sort of disruption in their housing or need back rent that may or may not be able to trace their situation directly back to the COVID pandemic. It's a broader definition, I believe. But honestly, I'm still waiting to get the full explanation for how when ERAP is going to pop into place and how it's going to be different than ESG. I'm sorry, I can't provide a better answer to that. Right at the moment.
No, that's helpful. I mean, it's one extra letter in the acronym, so that's. Thanks very much. I really appreciate that.
Sure. So the other kind of update from social services that I just want to let people know about. So we knew we've been working for a while on kind of a new component to our program that is related to kind of race equity and looking at how we really support families, and that we really address issues of disproportionality in our primarily in our foster care programming. So we, OCFS has asked all districts to develop what's called a kinship firewall process. And so we've been working on this for a number of months, and we just put it into effect. I think last week was the first week that we got it going. What this means is that we are really, it's an amazing process that one district started using kind of as a pilot and with great success. So what it really means is that you remove all information that would give any indication of what the race of the family is that you're working with. And this is when a child is going to be placed in foster care. Because really what they saw, what we look at across the state is that there is that disproportionate number of people of color that go into the foster care system. So by removing all of that detail and really looking at from, we've worked for many years from a strength-based perspective, looking at all the strengths of the family, looking at whether or not a safety plan can be developed, and really looking at what might be possible in terms of planning for this family. What we hope to do, and it has been successful in the pilot, is really minimize, placing people based on any bias, based on any implicit bias. So we started using this process. It means kind of pulling all the workers together, having a very specific meeting, discussing that family, very much in the same way that we would have before, but with a little bit of new structure and without all that information that gives us indication about race. So we've been utilizing that for a week. Obviously, we don't have any real solid information yet, but we're quite excited about it. And I would say that given the success of how it was piloted in one county, we're excited and hopeful that will contribute to our ongoing efforts to really try to look at those issues and make sure that we're serving people in the most respectful and best way. So that's kind of a new component to our work. So I think that's all I have from social services. Lots of stuff going on, and we're just trying to keep many things going to keep folks served. So.
Okay, thank you for your report. Any questions? I do have one question. So what's going on with Code Blue and the state's payment of that? Because I know the budget is up in the air, but I know you said that it was going to limit to 5%, maybe, if he got the money, but he got less than that.
Yeah, so Code Blue, what we are hearing at this point is that that 5% is going to be withheld. We kind of knew that, we knew that a little ways into our Code Blue, or we were anticipating that a little ways into our Code Blue program. So we've tried to look at what are the ways that we can manage that program as efficiently as possible. Some of that's been possible, some of it hasn't been, because we haven't really been able to use our congregate sites like we like to this season because of COVID. But that is really, unfortunately, Henry, that's the most information that we know right now, is that we're anticipating that there's going to be that 5% withhold. I've had a couple of nail biters periodically where it looks like it could be more, but it's looking like it's settling out with some of the release of federal money that is coming in. I think the state was hoping to get something like 15 billion. They were worried it could be as little as 6, and now they're hearing as of last week that they're going to get 12. So it's kind of not as good as it could be, but really not nearly as bad as it could have been. So I am really hopeful that the 5% withhold is the worst that it gets. And what I'm hoping is that because they continue to refer to it right now as a withhold, that we may see that money restored at some point. There is always the chance that that will turn into a cut, but I just don't think we know that yet. So we're just kind of waiting. So.
Well, thank you. If there's no other questions, okay. Move on to Office of Human Rights with Reverend Clark.
Okay, Hello, everyone. Just a couple of things to report. Last month, we organized a program called African Americans, the Death Cap and Health Equity, which featured Dr. David Ansel from the Rush University Medical Center in Chicago. Program that went very well, and there seems to be no shortage of programs on addressing issues of health equity and really highlighting issues such as racism as a public health crisis. And this was one of those programs, and there are more upcoming and to come from other parts of our community in the future. And so that was held on February the 25th. And this month, we are planning a program which you'll receive information about within the next few days on sexual harassment and its implications. This will be our offering for Women's History Month. And I'm in process of having to replace a panelist who had agreed to join us, but is unable now to join us. And once I get the replacement in place, we'll be sending out information to you about this program that's coming up. On March the 5th, I co-moderated with Reverend Nathaniel Wright of Calvary Baptist Church a COVID-19 vaccine office hours Q&A forum for people of color of faith, largely persons who are members of local Christian congregations, featuring Dr. Daryl Dykes of Upstate Medical Center. We have begun talking about, myself as well as the other planners, which include Deanna Carruthers, JR, Dominic, and others, about doing something that will be an outreach to other faith communities as well, and faith community, in particular, faith communities of color who are of other faiths. On Thursday, I will be co-moderating with Reverend Wright a Reimagining Public Safety Community of Color forum on Thursday at 6. Similar forum, Black Town Hall meeting was held about 2 weeks ago. And I've been working with Deanna, Dominic, JR, Shelley Nunn, and Pastors Benson and King. Pastor King is from St. James AME Zion, and planning this event coming up on Thursday at 6. And I have been working with Human Resources to lay the groundwork for the search for our open education and outreach coordinator position. So that's my report.
Okay. Do we have any questions for Reverend Clark? Do you know when the time frame will be when you will hold that next
program?
Sexual harassment program? Do you know the date?
Oh, it will probably be toward the end of next week. We just, it'll all depend on the availability of the speaker I'm trying to replace.
Okay. Okay, seeing no other questions, why don't we move to Mr. J.R. Claiborne from Veteran Services.
All right, good afternoon, everybody. All right, well, Reverend Clark just took part of my report, so I'll just say that it's been a pleasure. That's okay, you said it much better than I would. But it has been a pleasure in working with Dr. Clark and Deanna and the ministers and trying to bring attention to things about the vaccine and similar for the reimagining public safety. I'm also, as he said, we're working on that, and I'm also hoping that we'll be able to pull a office hours for vaccination for our veterans community. So I've got some feelers out about that, and hopefully you'll be able to let you know something here in the next couple of weeks. We are still supporting our Warrior Writers, which meets later this month, and our Veterans Coffee House, which on this Thursday also, which is a busy day for us. For our Veterans Coffee House, we'll also be having a session or presentation on the reimagining public safety. So Jason and Deanna are scheduled to be a part of that as well. And then lastly, the other highlight for me for the month was this month I attended the New York State Division of Veteran Services training on common law marriages. So as of most things with the Veterans Administration, nothing is simple, and common law marriage is a pretty layered situation when it comes to veterans benefits. So that's the big things for me.
Okay, any questions? Yeah, I'd like to talk about the background you have on your.
Hey, got to represent, right?
Right. You talk a little bit about that?
It is Women's History Month, and we cannot have that month without recognizing how important women have been in the military from the Revolutionary War up through today and beyond. There are many women who have been part of the service, and they've got out and they've gone back in. When COVID-19 really hit the stages that we did, and there were people being asked to go to New York City, there was a local veteran who was in the medical corps who just jumped up and said, "I'm going to New York." So, our veterans, our women are everywhere, and there are a lot of things that would not happen without them. And in particular, this background that I pulled, I loved it just because it has, let me move there. It has a representation just showing the breadth of just the diversity we have within our nation's defense, our nation's defense.
Okay. Thank you.
Thank you.
Thank you. And last but not least, Lisa Monroe from Office of the Aging.
Hi there, how you doing?
Fine, how are you?
Good, thanks. Not too much to report. Things are still plugging along over here. I'm happy to report that the vaccination calls have greatly reduced thanks to the extra supply in our community, which has been great. The staff have been able to help, over a couple hundred people that didn't have internet or computers sign up to get vaccinated, either at our mall site or in some of the local pharmacies. So we still have calls coming in, but definitely it's slowing down, which is great. And the only other thing I wanted to announce is that we are having our second workshop in our Age-Friendly Center for Excellence workshop series. It is this Wednesday, the 17th at 2:30, and it will focus on spaces and places, leveraging the built environment for successful age-friendly communities. And our presenter is Esther Greenhouse. Yes, and that's all I have.
Okay, thank you. Any questions for Lisa? Okay, I believe that's it for departments. Now we have some appointments to the advisory boards. I know Joanna Green is one for the Human Rights Commission. And then for the Development Disability Subcommittee, Allison Weiner Hyman and Adrian Lamb. Do I need to move those, Kathy?
Yes, Henry, you do.
Okay. I can get Amanda to move them. Second, Dan Klein. Any discussion on them? I assume you have them in your packets, including Joanna Green, which was emailed out last week. Okay, let's go to a vote. Amanda Champion.
Yes.
Dan Klein.
Yes.
Mike Segler.
Yes.
And I vote yes too, so it's a 4-0 vote. Now let's go to the minutes approval. These are minutes from February 17th, 2020. Now, mover, Amanda Champion. May I have a seconder? Dan Klein seconds. So does anyone have any questions or comments or changes to the minutes? Okay. Well, hearing none, let's go for a vote. Amanda Champion,
Yes.
Dan Klein,
Yes.
Mike Sigler,
Yes.
and the chair votes yes too, so it's a 4-0 vote. I assume that the budget transfer that you sent, Brittany, just needs to be in front of the committee. No one needs to vote on it.
No, it's just information only.
Okay. Do we have comments from committee members or liaison assignment reports? Anybody wants to talk about their reports? Okay. Hearing none of that, I believe we can take a motion to adjourn. Amanda moves, Mike Sigler moves. I assume we're all voting yes. So yeah, we all adjourned. And thank you for suffering through this meeting with me.
Thank you, Henry. Thanks for stepping in, Henry.
Thank you all.
Thanks, Henry.
Goodbye.
Take care.